Welcome to the Therapist Thrival Guide. My name is Miranda, and I am a licensed clinical social worker. I'm here with Jordan again. Jordan, do you want to introduce yourself for everybody?
Sure. My name is Jordan Neely. I'm a licensed professional counselor in New Jersey and one of the wonderful Family Ellie Mental Health Clinic directors.
Awesome. Jordan is amazing. And if you haven't heard her episode already, we just came out with another episode all about grief and loss. But we kind of like during that conversation, we were like, there's so much we can be talking about with this and with grief recovery method. Let's dive in a little bit deeper. Let's talk about, how do we help kids cope with grief and loss?
Right.
Because it might look a little bit different than how you might help your sister or you might help your adult clients. And so
Absolutely.
Excited to dive into this. Jordan, let's kind of start at the basics a little bit. Like how does grief and loss, what does it look like in kids? Does it look the same in adults? How can we help? How can we what are some, I guess what I'm trying to ask too is it's like, you might see some behavior show up. How do
Absolutely. You got it.
So what does it look like?
Sure. There can be similarities, of course, because, we're all human beings. So we are going to express, emotions maybe a little bit differently. Depending on what the emotion is. We are going to notice in adults or in children behavior changes that are related to grieving. So you can typically, a few of the main most common grief-related symptoms that you can see across the lifespan. Difficulty concentrating, forgetfulness, and sleep disturbance, even to an extent for across the lifespan, social withdrawal. Because, it's such a set of, can be, complex and conflicted emotions that are related, normally and very naturally related to loss, where it impacts that ability to function on a daily basis for people across the lifespan. And especially for children or adolescents, not necessarily yet having the language and the insight to be able to say, whoa, like what's going on here? And how come I'm forgetting so much? How come it's so hard for me to focus in math class? And, I just, got a low grade that I usually don't get in the class that might be the easiest for me typically after a loss. So those are some across the lifespan similarities in grief-related symptoms.
No, that makes sense. I remember when I first started providing therapy for kids, I was seeing a kid, like a preteen-ish age boy for some pretty significant anxiety. And I remember when there was no grief and loss, like nothing happening, just working on some self-esteem stuff, working on some anxiety symptoms. And he came to session one day and he told me that his puppy had passed away in a really traumatic way, like super traumatic, really sad. And this was something that I was shocked first off, and also was like, oh my word, I am not a grief therapist. And how do I help you through this? It was like, I think even with it being traumatic was a whole nother thing. But I think that this topic is important because we will all find ourselves in the exact same position that I was in that moment where it's like,
sure, absolutely.
Even if you are not a grief therapist, if you're not somebody who really works on loss with clients, this is going to happen eventually. Something is going to happen where a client walks through your door, sits on your couch and says, something really awful happened this week.
Yes.
And if you're like me and you didn't have any sort of, I had no idea it was coming. I mean, he sat down and was like, I'm like, hey, you seem a little bit down. What's going on? And so in that scenario, I can hear people listening to this being like, you're not a grief therapist. Maybe should you have transferred him? But in that moment, absolutely not. I had been seeing him for a couple of months. So it's
absolutely.
tricky
Absolutely.
situation, right? And so,
Yeah.
um, so I guess I'm just thinking through like his symptoms of grief were pretty like you could recognize it right away. Like he was really
Yeah.
down, he was sad. I mean, and even for like the following couple of weeks, he was just really irritable and angry and isolated, just like what you had kind of said. Some of the things
Yeah.
that you were saying reminded me of him. And so yeah, like just super clear changes between
Yeah.
kid before, kid after. And so
Sure.
in I'm curious too about kind of like talking through how do you approach grief and loss with kids, and is it different when it's like the grief happened this week versus like, oh, this happened
That's a
a
good
couple of
question.
months ago?
Mm-hmm. Yeah. I
I
mean,
don't want to be like,
good question. No, all good things. Um, and I will get onto my soapbox really fast. 1 foot on, that's it.
absolutely
To
good.
just say like how common and and really realistically to expect that any client walking through your door, of whatever reason or reasons they initially came in seeking help, you think about it. We have our treatment plans. They're a working in progress type of thing, because if you look at your treatment plan, at least I will be honest, for me, every week I'm not just stuck on where are we in this treatment plan right now, because life happens. I'm going to curse, shit happens throughout throughout every week, 2 weeks of all of our lives. So when they come in, when that boy came in for you, and their dog had died, I mean, that's life. Life happened. And how could you in your gut and in your heart be able to say, oh, this isn't my wheelhouse and I shouldn't go there, so let's get back over here, Johnny, and we'll figure out the loss of your dog later, but we can't talk about it right now. It's just not realistic at all. And I'm so shocked and I don't know of any yet, and maybe they're out there now, which I really hope there are, but just graduate programs for us that have a grief and loss component, or just have a life transitions course or something that includes the grief and loss part. And it's not particularly, because I've heard of people touching upon death and dying in graduate programs. But again, as we talked about last episode together on this topic, grief and loss is not only by a death of a loved one or a less than loved one. There are over 40 different kinds of losses. And those losses show up, I would say, more than not, in every client's treatment time. So there's that. I'm going to come off my soapbox now.
That's a good soapbox to be on, though. Like, you're absolutely right. No, it's
yes,
good.
advocacy soapbox. Yes.
Mm-hmm.
So for children, research shows, and through the Grief Recovery Method Institute, that the most likely first loss for a child will be the death of a pet or the death of a grandparent. So you see those, and this is the dog, a representation of such a source of love and affection for that child. And that kind of goes into, for me, like, yes, it's a pet, because I think some people will be like, well, not all. Some people may say like, oh, it was a pet. Like, we can replace that loss, or, well, at least it wasn't a parent or a sibling. And pets are the family members too. I have a fur child, and she is the light of my life. So that kind of goes into making sure that we are very cognizant to not compare losses. One, for ourselves as adults, and then two, very, very much not comparing losses to a child, because of how easily impressionable and influenced they are by the adults in their life, the words that they say, the actions that they take. They're little sponges, as we know. Little sponges. And in terms of, I'll keep going. I think I'm actually going along with all of the questions and without getting
No,
too
you're doing great. I like
derailed.
threw 4 questions at you all at once, and you.
I'm like this. Focus.
No, you're doing great. I love it.
For the loss, either being very recent or immediate versus, let's say, a year, 3 years, 10 years down the road, you're going to treat and listen to each one for whatever level of significance that it is expressed through for that child or for that person. So we're going to recognize that grief is emotional. It's not intellectual. So that also means that we understand and we are modeling that there isn't a specific timeline or time period where grief should be at its worst, where it should be done, where we got to a level of acceptance, because that looks different for everyone, because it's grieving is not linear. Just like most of life's events are not linear. So let's be patient. Let's not force a child, even to ourselves too, as we actively grieve different losses. Let's not force the talk or force the child to talk. Let's just be patient, and letting them kind of come to a time where maybe they want to talk about it. In the same token, though, we are the adults. So if we're going with children and adolescents, we're the adults. Let's go first. So let's tell our child, and I was sharing with you earlier that I'll say our child or your child, and for people that are listening, that is for you as a therapist, your child as the client. You as a parent or guardian, your child. You as the school counselor listening here, your child. You as the religious leader, your children, your child. So as the adults, go first. Tell the truth about our own grief, and make it safe in a way for the child to open up to. And again, when they're ready to. It might not be immediately, just because we're doing it, that they're like, okay, let's go for this, because they're listening and absorbing and watching. How are you reacting, and what are you sharing about your experience? If you're not directly affected by the loss that child is going through, just tell them something similar or a parallel loss that's in your life. And remember, no comparisons.
I think that's one of the things that I struggle a little bit with this topic too, of like, if you are, so with that case that I had, the whole family was grieving. It was like the whole family was there when it happened. It was sad. And so I was having conversations with mom, and she was saying, like, we are all reacting in such different ways, and I don't know how to help my child through this. And I've heard similar things where, like, I've had other times where grief and loss have shown up in my personal life, and I can relate to that too, where it's like, I don't know how to help you through this because I'm dealing with this too. And so do you have any, like, how do we as grownups, like, show up for our kids when we're also dealing with this? Or, like, what advice could therapists give to families that are dealing with this kind of as a whole unit?
Let's go back to just emphasizing to everyone and for ourselves and as parents and, those people that are showing up as the models, let's say, for these children, that there are emotional reactions to loss, right? And so we are able to allow all those emotions to be there, or at least practice allowing those emotions to be there, even when it may be in front of your child. Because without judgment, without criticism, we are going to listen with our heart and not with our head, right? So again, we are recognizing grief is emotional, it's not intellectual. So listening with our heart instead of our head. sharing, again, as the adult, sharing what our own experience, our own emotional truth is with that grief, or with grief that may be something similar that has happened in our life, to show them. I know my cousin, she's my best friend. We grew up together like sisters. She has a boy and a girl now, 9 and 6 years old. And we are constantly talking about this because both of them are she's very open to talking about emotions and learning all about, and teaching them all about just social nuances and conformity and things like this. So we talk about it a lot, of where we both, because I'm with them quite often, where we both will be very mindful and practice. There's slips, and we're human. That's going to happen. But practicing, not to ask them when you're seeing a child express sadness or anger or worry, that not to ask what's wrong, but what's happening for you or what's going on. Because then you're at least opening up that conversation, or at least not using some key terms of like no or don't or why and wrong. Because in our society, those words are usually kind of instant, like, oh, all right, let me back up and kind of close off a little bit and figure out why are they questioning me that way. So what's going on? What's happening for you right now? And even as a counselor, also as a therapist, teacher, track their facial expressions and verbalize that right back to them. Like, I see that your eyes are filling up with tears, or more watery than I usually see them. Or, I'm noticing that your body kind of like turned away from me, or like you started looking down when I asked you the question about what it's feeling like because of your dog not being in the house with you anymore. What's going on there? And if we need to, we use the good old feelings wheel, or a feelings chart of some sort to give that child the ability that if they don't have the words, they can recognize it either by, if it's an older child, obviously the feelings wheel is a little more easy. But for a younger child, I'd say probably early middle school and below, using the feelings chart of facial expression so that they can point to maybe what they can recognize them feeling as. So simple, good charts, but they work. But I think that just listening with your heart and not with your head, because there is no right or wrong when you're grieving. Everyone grieves at 100% for themselves. And even as parents, if you're experiencing the loss of something that your whole family unit, like the dog, that they're all experiencing, is still being able to emphasize and allow yourself to know that with all of you going through losing that dog, every person in the family had their own unique relationship with that dog. So their reactions are going to be different because their relationship with the dog was different than their husband's, to their child's, to whoever else was in that house. That was a long one.
No, that's good. What about if a child doesn't want to talk about it yet, or just is like, doesn't want to talk? And
yeah,
would you, I think this is kind of a leading question. Like, would you try to get them to talk about it? What would you do?
You want to, right? You really want to, because you just want to be able to help and comfort them. So in my, most of the fibers in my being, especially being a therapist for some children that have been grieving, I want them to, but I'm going to go back to being patient and not forcing them to talk about it. I do not have human children, which I will say, do not have human children. However, I will at least share to be able to possibly open up and normalize the experience of grieving. So I'll share, to an appropriate extent, my own relationship to pain that was caused by a loss or a loss event that was in my life. And being able to, as I can, with obviously some of the things we already know as therapists, kind of connect of how relevant that was in childhood, maybe around that person's age, and just share. So just being able to kind of share a little bit about me, because I think that with children and adolescents, and working with them for a long time now in our field, if you're willing to and you have that comfortability to give some personal and self-disclosure that could relate to them, I think it goes such a long way. And again, they still might not say something immediately, and that's okay. I think that's more on us to have to say that they're not there. And so we can't make them get there. It's going to be counterintuitive. It's going to shut them down possibly for a longer period of time. So just be patient. Just be patient. And sometimes some expressive arts interventions could be really helpful. Different types of drawings with a certain, set of instructions, or just playing a game that might be just related to and around processing emotions. Maybe the loss will pop up that way too. So there's different ways that can be non-directive that will not feel as forced or threatening at that time for a child or adolescent, that we definitely can try. But at the end of the day, it's going to be when they're ready for it. And we just have to be patient with that and be respectful with that.
When you're in this space, you hear of a lot of different ways that you might help kids or adults like memorialize their loved one or the loss that they're going through. Have you ever done anything like that with kids?
Yes. So there, and I wish we could just do all of them, more of them all the time. So we will, what I really like for kids, and this one, I just want to put it out there because I want people to know about it, is that, and you can find them, most of the artists on Etsy, of course, but there are, at least in New Jersey, the hospice center in my home county here, I work with them part-time still. And they have a couple in our area, a husband and wife in our area, that make memory bears. So they're teddy bears, and families or the individual that is grieving someone will donate and give this couple a piece of clothing, an article of clothing, or even like a blanket. And then that couple is making teddy bears with the article of clothing that they now have put in as like a little shirt for the teddy bear, or like if it was a blanket, a piece of the blanket the teddy bear sewed on and is like holding in their hand, or something that commemorates their loved one. It like gives me goosies because I just love it. So that I think is a great, wonderful
Jordan,
idea.
I have one of those.
You do?
Yeah.
I love
So
it.
I was really close with my great grandma before she passed away. And I have a picture of us on my wedding day. And then my grandma so the outfit that my great grandma was wearing on my wedding day, she had that made into a teddy bear. And so I have one of those. I love that. I had never heard of it, but it was just in the last few years that, I mean, she's been passed for, a couple of years now, but I just got one of those from my grandma. I had never heard of those before that.
Wonderful.
They're so cool. Yeah.
They are. And just to be able to have that tangible piece and be able to cuddle it and hold on to it, and, even just share the story about it with other people, so that you're also just bringing that person back up into life. So the memory bears, I love. And you can find other artists on Etsy. If you don't have someone in your life or local that makes them, you can do it there. Also pillows. I have a pillow, and a different cousin of mine is a seamstress. So when my grandfather had died, my poppy, I had given her one of the cardigans that he wore all the time. And so she made me a pillow. So the cardigan is the pillowcase. And I love it. It's one of my prized possessions. Because I was wearing the cardigan for a while. It was very big on me. And then I'm like, you know what? I want this with something else. It's kind of like more safe and staple in my house. So those are great ideas. In sessions, or even at school or at home, I share and tell people, whether it's at home or with me, like if you have pictures of the person, the animal, Again, remember, loss is not just about death. And so for a child, a loss can absolutely also be the move from one house to another. And even if it's within the same town or city, you're still usually at that point having changes with your schools, with your playmates. So there can be a really powerful emotional shift for a child with a loss like that. So even if it's like pictures of the house or pictures of that class when they were still living at that house, to be able to come in and share, and maybe we'll make some sort of collage about it. And then, different colors that are in the collage that they start decorating it with symbolize different feelings. At home, I'll recommend that, maybe they have a sort of like memory table or memory corner where they can have kind of almost like a memorial type of thing for whatever loss or loss event it is. In session 2, and I love music. Music is probably one of the most faithful coping strategy that I have for myself going through pretty much anything. So we will also make soundtracks. And it can be a very emotionally charged session or few. And usually something like that, I'll probably share with the parents or guardians that I'm doing it. We'll make a soundtrack of whatever artist's choices of songs that the child has. And then we'll talk about, like, how on CDs, which maybe many people don't even know what they look like, but on CDs, which I do buy. Let me see if I'll show you mine. So something like this. So I'll buy CD cases, and then I'll have the child make a cover of however it represents that loss. And then they'll choose their songs. We'll talk about why. But then, so each song, how on CDs the artist or band used to give the little biography about them. So then I would ask the child to also take time in a session, or it might be a full session, maybe more, to write a biography about the loss. And so then that CD or that soundtrack is something that they can hold on to, and then they'll make the playlist on Spotify or whatever they have at that point. And that's what it is. But it's a different way to be able to process it, and then also bring in something that's, again, a little less directive so that they can really be more open about expressing it.
I love that idea. I used to make playlists and burn CDs for all my friends.
I still have some somewhere.
I was about to say, are you burning CDs for people? I was like, how are you even doing that now? No computers have disk drives anymore.
I know. My car doesn't even have a CD player anymore.
Mine doesn't either. No.
Really sad.
Weird. Oh, I love that idea. Do you ever have, so you talked about the biography. Mm-hmm. I've also seen different activities. I've never done these with kids, but where they might write an obituary or a eulogy, or write a letter or something like that. Have you ever done anything like that with clients?
I have. So more the eulogy I've done with adults. And I have not gotten there yet with doing it with a child. And when I say a child in this sense, I likely would recommend, and this is me, I would likely recommend doing that with a child that's 14 and older, because of just, the narration of it. And I think just more of a emotional maturity appropriateness to it too. Whereas maybe with someone younger, and again, that's also writing now and can put things down in words, that we also go back and forth with a grief journal. And I have adults do this too, but having a grief journal where after each session, when we're processing a loss and grieving, that I give them a sentence stem or two that then they're going to go home with their grief journal. And at some point before our next session, they're going to have some private time that family is aware of, where they can sit and be uninterrupted to do one or both of those sentence stems. If they need a break, absolutely take a break. You don't have to do it all in one sitting. And I really emphasize that, because I don't want them to be forced to do something or do something from start to finish if the emotions are getting a little too high. And we have to also assess that too. But the grief journal seems to be really helpful because then it's going to be something that they can keep along with them as we go, and that they can kind of go back to and reflect on as well, as they're kind of going through their own healing process.
What are some different like prompts that you would give people for the grief journal?
Pretty basic, I think, like being able to just say, my grief looks like blank. Once we get into, and it might be because I want them to also start recognizing and learning what their grief symptoms are for themselves, especially children and adolescents. Maybe I give them, and I'm a terrible drawer, but I might tell them to draw like a figure of a human in their journal. And then the prompt will be, where do I feel my grief? Or where does my grief show up for me? And we'll talk about, stomach aches and butterflies, or headaches, or interruption with sleep. So we'll talk about those things too. Another big one that I didn't mention before to look out for as well that is common is actually, now I'm going to forget the word, bedwetting. Is bedwetting for children when they're actively grieving. That there is some regression that's researched and seen, particularly with wetting the bed at night. We will also, some of my other prompts may just be like, this blank, so this person, this, move, this, whatever it may be of what the loss is, this blank means to me, and then letting them kind of explore what that is. My life has changed in the following way or ways since the loss. So those are just a few of the sentence prompts that I'll use, and really more in the here and now. And then later on, we may even get to a point where we're saying, since blank has happened, or since blank has died or has changed, here is something or the things I wish blank got to see, or I wish blank was a part of, or I wish I had when I was at blank. Just to kind of process that, and to also normalize that, that there are going to be unmet expectations and wishes toward that loss that we're going to experience for an unknown amount of time.
Okay, one last question. I am curious, like, as you're working with kids through this, how do you address death, or even just like, is there a role that religion might play in this too?
Of course. So I am a believer that, because in our society we use passed along more than really anything else for a death. So I will address the elephant in the room more times than not with a child of the word death, and that this person died. If we're talking about that in particular as the loss. So we'll talk about it. I also really, I think before that happens, or as that's kind of happening, there, for me, a big emphasis on at least one of the parents, guardians, caretakers being a part of that process with us. Because depending on the age of the child too, they may not know all of the kind of expectations and roles and norms of their culture or religion to death. So I have to do the due diligence and want to know about if it's a very different religion and culture, or just one that I'm not familiar with, of course, to be able to absolutely make sure that I'm opening that door of conversation to learn and understand from their caretaker in whatever role, to know what that looks like. What are the beliefs? How is it usually discussed within your culture? Is that something that at this time your immediate family, your nuclear, is still following and valuing, or, maybe someone's family has emigrated and now they're kind of more than not acculturated to the American culture and the way that we speak about it. So like what does that look like for them? Because, I absolutely want to and recommend for everyone to be understanding and respectful to what that is. And at the same time, also giving them some of the psychoeducation on the evidence-based pieces of, let's just say for me, grief recovery method, that I may use certain words and phrases because this is what's seen as evidence-based to use as a professional. And not that in any way, shape, or form, I'm trying to say no to your way and yes to mine, but how to be able to respectfully integrate the two. And at the same time, making sure that we are hopefully doing what's best and most supportive and beneficial to the child who's grieving.
Well, and I'd imagine too, like trying to talk pretty concretely about like, this is what happened. And
yes.
No, I think that having a parent or a caretaker as a part of that conversation makes a lot of sense, just to kind of see where they're at or how they approach that conversation.
You're right. You hit that too, because you have to also, like the parent, like you said before, the parent could be grieving, the caretaker could be grieving too. And so how have they been showing up or not been able to be showing up to recognize their own grief and how or not that they're being honest about their own grief to that child or not. So it's good to be able, it's good to have those people in there, because as I say, for any person working with children or adolescents, that it's silly to expect that we're just treating them. It's silly and unrealistic to expect that this child or adolescent is going to continue on doing what we're working on together if the family system or the person they're living with is not actively involved in creating a very similar, consistent message and change with them during their treatment for any reason.
No, that makes a lot of sense. Well, we are coming at time.
Wow.
I wanted to I
want to talk with you forever.
I love it.
Me too.
I wanted to put a quick plug in here too, because I worked with some therapists to compile a list of different books that they recommend for kids that are going through the grieving process. So I will include those in the description of this podcast episode, so that if you are, like personally dealing with a loss or helping a child walk through a loss in their life, then you'll have that as a resource. Any other last thoughts, Jordan, that you'd want to be sure to include in here?
I think it'll be my hokey therapist thing, but also who I am as a person of just remember, be gentle and be kind to yourself. Conversations are, especially on difficult topics or on emotional topics, are challenging, because each one of us are going to perceive it and cope with them differently. So just remember to be gentle and kind to yourself. And it's okay when we make a mistake or we may have some regret about it. You'll do differently next time.
Well said. I love it. Well, thank you so much for joining again. And
of course.
I'm excited. We're going to have Jordan back for another episode soon to talk about, I'm putting this out there because we're going to schedule this and do this, but we're going to have her back to talk more about like logistically talking about finances with clients and like outstanding balances and insurance and some of that icky stuff that we as therapists don't really love doing. And so Jordan is a master at that. And so we are going to
try my best
to talk about it. I love it. Well, thank you so much for listening. Thank you so much for watching, and we'll see you next week.